gastroenterologist is a physician who specializes in diagnosing and managing diseases of the gastrointestinal, GI, tract, and liver. Gastroenterology is the medical field focused on understanding the normal functioning and disorders of the digestive system, which includes the esophagus, stomach, small intestine, colon, rectum, pancreas, gallbladder, bile ducts, and liver. This specialty requires a deep knowledge of the physiological processes of these organs, such as how food moves through the stomach and intestines, motility, how nutrients are digested and absorbed into the body, waste elimination, and the liver's role in digestion. Gastroenterology covers a wide range of conditions, including colon polyps, cancer, hepatitis, gastroesophageal reflux disease, GERD, peptic ulcers, colitis, gallbladder and bile duct diseases, nutritional issues, irritable bowel syndrome, IBS, and pancreatitis. Essentially, it encompasses the study of both normal and abnormal functions of the digestive system. The scientific exploration of the digestive system began with Jan Baptist van Helmont in the 17th century. However, significant advancements came in 1833 with the publication of William Beaumont's groundbreaking observations, which provided new insights into the nature of gastric juice and the digestive process. A notable development in the 19th century was the introduction of gastric lavage, a procedure used to treat stomach poisoning by washing out the stomach. This technique became a standard treatment for various forms of gastric irritation. The tube initially used for lavage was later adapted for diagnostic purposes, allowing physicians to view the stomach. Around 1889, a significant innovation came with the invention of a tube that could be inserted down the esophagus, equipped with a mounted light to illuminate the area being examined. This rigid instrument marked the early days of gastroscopy. A gastroenterologist typically begins with a physical examination, which may involve palpating and listening to the abdominal area or performing a rectal exam. To gather more information, they might order a variety of follow-up tests, including blood tests, stool tests, or imaging studies such as GI X-rays. However, when these tests don't provide enough information, gastroenterologists are uniquely trained to conduct endoscopic procedures. These procedures involve using an endoscope, a long, flexible tube with a tiny video camera at the end that is inserted into the body to provide a direct view of the internal organs. Endoscopic procedures performed by gastroenterologists. Upper endoscopy, EGD. This procedure examines the upper gastrointestinal, GI tract, including the esophagus, stomach, and upper small intestine, duodenum. Enteroscopy, a procedure focused on examining the small intestine. Colonoscopy. This examination looks at the lower GI tract, primarily the large intestine. Endoscopic ultrasound, EUS, combines endoscopy with ultrasound to provide detailed images of the GI tract and biliary system, either from the upper or lower tract. ERCP, endoscopic retrograde cholangiopancreatography, an upper endoscopy procedure that extends into the bile ducts, accompanied by fluoroscopic X-rays to visualize the biliary system. Polypectomy, the removal of polyps from the stomach or intestines during an endoscopy. These endoscopic procedures allow gastroenterologists to obtain a detailed view of the digestive organs, aiding in the diagnosis and management of various conditions. Additionally, these procedures enable gastroenterologists to take tissue samples, biopsies, and perform minor therapeutic interventions such as removing blockages, stopping bleeding, or excising tumors, all without the need for more invasive surgery. Gastroenterologists are often the first specialists to detect cancer in the digestive organs. Through endoscopy and biopsy, they can locate, remove, and identify cancerous tumors throughout the GI tract and biliary system. If cancer is found, gastroenterologists may perform further endoscopic procedures to stage the cancer, which involves taking additional tissue samples to determine if the cancer has spread. In certain cases, they can also treat tumors directly using endoscopic techniques such as dissection or laser therapy. Cancers diagnosed, staged, or treated by gastroenterologists are as follows: stomach cancer, colorectal cancer, gastrointestinal stromal tumors, duodenal cancer, small intestine cancer, esophageal cancer, liver cancer, pancreatic cancer, gallbladder cancer, bile duct cancer, Even when a gastroenterologist is part of a broader oncology team treating other types of cancer, their expertise in endoscopy may be crucial. They might be called upon to search for signs that cancer has spread beyond its original site, or to address GI side effects caused by treatments like chemotherapy or radiation. Conditions such as mucositis, inflammation of the mucous membranes, or radiation enteritis, along with symptoms like nausea, vomiting, diarrhea, constipation, and malnutrition, are areas where a gastroenterologist can provide essential care and guidance. Internal medicine is a medical specialty focused on diagnosing and treating diseases in adults through non-surgical methods. Unlike surgery, internal medicine encompasses a comprehensive approach, addressing the entire patient rather than focusing on a specific organ system. It serves as the foundation for many other medical specialties, including cardiology, dermatology, and gastroenterology. Physicians who specialize in internal medicine are known as internists in the United States and many other countries. Medicine primarily focuses on the art of diagnosis and treatment through the use of medications. The diagnostic process is a systematic approach that involves gathering relevant data, generating potential diagnostic hypotheses, and iteratively testing these hypotheses against evolving disease profiles to determine the most effective treatment plan for the patient. Data collection is a critical initial step, which typically involves directly engaging with the patient through medical history taking and a physical examination. This interaction provides first-hand insight into the patient's current condition. Additionally, previous medical records, including laboratory results, imaging studies, and notes from other physicians, serve as valuable sources of information. However, it remains essential to directly converse with and examine the patient to accurately capture their present experience and symptoms, which is crucial for making a correct diagnosis. Internists, who are trained to manage a wide range of adult diseases, often perform and interpret various diagnostic tests, such as electrocardiograms, EKGs, and point-of-care ultrasound, POCUS. Those who specialize in subfields within internal medicine have access to even more advanced diagnostic tools, depending on their area of expertise. Cardiology, techniques like angioplasty, cardioversion, cardiac ablation, and the use of intra-aortic balloon pumps. Critical care medicine, management tools such as mechanical ventilation. Gastroenterology, procedures like endoscopy and ERCP. Endoscopic retrograde cholangiopancreatography. Nephrology, dialysis procedures. Pulmonology, bronchoscopy for examining the airways. In addition to ordering specific tests, internists often refer patients to specialists for further evaluation. The efficiency of this referral process is an area that continues to seek improvement. This stage involves identifying which pieces of gathered information are most relevant to advancing the diagnostic process. It's a critical phase where clinical biases, such as anchoring or premature closure, can potentially influence decision-making. Once key findings are established, they are compared to the profiles of possible diseases. These profiles are constructed based on the typical symptoms associated with each disease and the likelihood of these symptoms occurring in someone with the condition. The resulting list of potential diagnoses is known as the differential diagnosis, ordered from most to least likely. Special attention is given to conditions with serious consequences if overlooked. Epidemiological factors and regional disease prevalence are also considered when evaluating and refining this list. The differential diagnosis is not static. It evolves as new information becomes available, allowing physicians to rule in or rule out conditions based on updated disease profiles. This dynamic list guides the decision-making process for subsequent tests or imaging studies. Physicians select these tests based on their understanding of each test's specificity and sensitivity, ensuring the most accurate and efficient diagnostic approach. A thorough understanding of the various ways a disease can manifest in patients is essential for this process. This knowledge is continually expanded and shared among medical professionals, which is particularly important for identifying and managing rare diseases. Effective communication is integral to the diagnostic process. Internists regularly engage in both synchronous, real-time, and asynchronous communication with other healthcare team members, including fellow internists, radiologists, specialists, and laboratory technicians. Tools and protocols for evaluating teamwork and communication effectiveness have been developed and applied across various clinical settings. Clear communication with the patient is equally important. It ensures informed consent and supports shared decision-making throughout the diagnostic and treatment processes. Treatment approaches can vary widely and typically include both pharmacological, medication-based, and non-pharmacological methods, depending on the primary diagnosis. Non-pharmacological treatments might involve lifestyle changes, physical therapy, or rehabilitation services. Treatment strategies often differ between acute inpatient settings and outpatient care, with continuity of care and long-term follow-up being essential for successful patient outcomes. Beyond diagnosing and treating existing conditions, internists play a crucial role in assessing disease risk and recommending preventive measures, such as screenings and lifestyle interventions. Tools like genetic evaluations are available to help identify risks for certain diseases and guide preventive care. Internists also frequently perform preoperative medical evaluations, providing personalized assessments and communicating potential operative risks to patients. In summary, the practice of medicine, particularly in the field of internal medicine, is deeply rooted in a systematic approach to diagnosis and treatment, underpinned by rigorous data gathering, thoughtful analysis, and continuous communication among healthcare professionals and patients. Whether you're seeking to understand your symptoms, manage a chronic condition, or simply ensure your long-term health, the expertise of an internist is invaluable. Their comprehensive approach to care, combined with their commitment to patient well-being, makes them essential partners in your healthcare journey. Please click on the next video for more Live Good info. Thank you very much.